One of the interesting things for me was to hear from particularly policymakers and others working in the area of public health that more than a decade after SARS and several years after the pandemic influenza, that information sharing is still one of the key challenges. So timely, accurate and reliable information sharing among stakeholders, among public health agencies, private and public sector researchers and so on. So this is quite an interesting one. The second interesting one is that the problems that exist within the Canadian context with respect to provincial, federal collaboration in a way mirror what happens also at an international level. So problems exist in information sharing both nationally, internationally and within regions. And a third interesting thing I found of the stakeholder dialogue is that there seemed to be a general sense of skepticism about the ability of the World Health Organization as an important international governance organization to deal with many of the key challenges that we see in the context of public health. So not that people don't think that the WHO has a role to play, but that certainly with respect to firm governance, the role and the ability of the World Health Organization to help with significant progress is quite limited. I work particularly in the area of pharmaceutical governance, and so my recommendation will be limited to that, but I believe that there is an important challenge with respect to reconciling international trade regimes and international intellectual property regimes surrounding pharmaceutical products and the protection and the promotion of public health. So currently as a result of international intellectual property regimes and national drug regulations, pharmaceutical companies have actually gained quite a lot of control over the generation and distribution of knowledge, and this sometimes at the detriment of public health. The decisions made in the context of stockpiling, for example, have highlighted the fact that sometimes when industry interests drive decision making, we have significant waste in the context of public health. So that's one global challenge, is access to information. The second challenge is with respect to drug development to address issues of public health and pandemics. We see that there is, for example, a growing antibiotic resistance. The traditional drug development model will not work in that particular context, and so we need staggered introduction of drugs, strictly controlled by government. We need probably also government stimulation of particular areas of drug development.